Dr. Mankin, what company do you work for?
Well, right now I'm setting up my own practice, which is going to be a practice called NC Pediatric Pediatric Orthopedics.
Okay. What do you work for? What company do you work for right now?
Well, I'm sort of between things. I was working for a group called Raleigh Orthopedic Clinic.
Okay. How much and what type of education did you receive?
Your type of education? How do you mean? I'm sorry.
Like, which college did you go for your?
Oh, I see. I get you. Okay. Let's see. Well, I graduated high school, of course. I did 4 years of college at Harvard University.
Mm-hmm.
Then I did 4 years of medical school at University of Pittsburgh.
Okay. Pittsburgh. Okay.
Pittsburgh, yeah, in Pennsylvania. Then I did 6 years of what we call residency, which is the training that a doctor goes through.
Mm-hmm. What program did you use?
I was at a program called the Combined Harvard Orthopedic Residency, and that's in Boston.
Okay.
And then I did 1 year of fellowship in pediatric orthopedics, and that was also in Boston.
How much and what type of work experience do you have? Oh, is that?
Let's see. I've been working. If you don't count residency, which is more part of the education, I've been working for 17 years.
Oh.
Actually, now 18 years. And it's been all in orthopedics. So as soon as I finished residency and fellowship, I started a job as a doctor.
Mm-hmm.
And I've been working pretty much continuously through.
What do you like and dislike about your job?
Well, what I like about my job is how interesting it is. I like the fact that I never know what's going to happen day to day in terms of who's going to come into the office, what kinds of problems I'm going to see.
Mm-hmm.
Big variety. It's really puzzle solving. You have people come in who have a problem, and you have to figure out why they have their problem, and then you have to figure out what to do for them. I really like working with kids, so being a pediatric orthopedist is great because I get to treat just kids from really from the time they're born through the time they go through college. What I don't like about the job is that it's long hours, at least it can be, that you're responsible for these kids, and if someone gets hurt or if you're on call, you have to go in middle of the night sometimes. There is pressure on, obviously. I'm a surgeon, so if I'm doing an operation, I have to make sure it comes out right, and that can be pretty intense at times. And then there's always politics and having to worry about the financial aspects of it. Are you going to be able to make the practice work? Are you going to be able to see enough patients? Are you going to be able to get the insurance companies to pay for the work you're doing? Things like that.
So you have to make the practice work, enough patients, and insurance.
That's right.
Have you seen a relationship between the amount of stress and the increase in your salary over the years?
Actually, I have. The harder I'm working, the more salary I'm getting, but the more stress there is. There's no question.
Okay, so the harder I'm working, the more stress.
The harder I'm working, the more salary, but also with that comes more stress.
How many hours do you usually work in a week?
In a busy week, probably about 50, but I'll have weeks where there'll be 30 to 40 hours.
Okay. Do you have to travel, and if so, to what kinds of places? Is traveling a benefit or added stress?
Okay. I do travel, especially now I'm doing some teaching, and you have to go to conferences from time to time. traveling is fun, especially because if I'm teaching and if I'm seeing people who are other pediatric orthopedists, so you get to share ideas and all that. It is a stress because while you're gone, you're always worried about who's watching the patients, who's keeping the office open.
So there's some stress because you have to worry about who's taking care of the patients.
Exactly.
What kind of places have you been to?
Have I been to?
Yeah, like.
Yeah, well, I've been really all over the world with this. Most of my meetings are local. This year I've been to San Francisco, I've been to New Haven, Connecticut, I've been to Boston a few times. I've been to meetings as far as England and Brazil.
Wow. Mm-hmm. What would you do differently in the same with regards to your career?
I really like my career. I like what I do, so I wouldn't change from the aspect of what I do. I would definitely have chosen a smaller group to work with, right? Mm-hmm. The group I just left was a lot of doctors, and that added a lot of pressure because you had to just basically sort of keep up with them at times, and a lot of doctors have a lot of demands, and it's a little hard. You feel like you're getting run over by the doctors who make more demands. So probably a smaller practice. Certainly try to figure out a way to spend as much time as possible with the kids and their families, because that's important in my job. When it comes to the balance between working and being at home, I think I've done that pretty well. I feel pretty good about the fact that I've been able to spend time with my family. So.
Okay. And I think that is all. Thank you so much.
Sure. That was an interesting interview.